Health inequality doesn't respect city or county boundaries. In Warwickshire, for example, the north of the county has a shorter life expectancy than the south. The local county council is working to tackle the challenge, and as our reporter discovered, they have some very inventive strategies.
Warwickshire is perceived as being an affluent county. The population is ageing and enjoys a higher than average life expectancy. However, for parts of the county, particularly for some areas in the north, it's a different story.
In males particularly, you've got a life expectancy which is almost 8 years less in the most deprived areas than it is in the most affluent, and in women that's 7 years. We've also got high levels of women smoking and pregnancy, around 300 people a year, and high levels of people who are overweight or obese. That's almost 40%.
The figures are worrying, and so are the consequences.
Too many people are dying in our area from cardiovascular disease. We started some work to develop action, systematic action, and established a local cardiovascular programme board that links in with our health and wellbeing partnership with the two borough councils. Together, what we do in those meetings is look at all of the areas around what action can we take collectively to address prevention in terms of people getting sick in the first place.
One outcome of that collaboration was a campaign launched earlier this year aimed at preventing people developing heart disease. The council's been encouraging people to adopt a healthier lifestyle simply by changing one simple thing in the way they live. And they're doing it through this campaign, the hashtag One Thing campaign.
The hashtag One Thing campaign it's very simple. People understand it. It's about one small change to change their lifestyle, and working in partnership with many organisations, all coming together to support individuals to achieve that change. It could be something as simple as cutting down the amount of sugar they're eating, or going for a walk. It doesn't have to be really big. I wanted to make it achievable.
We had to sign up, so it's just make a pledge to do one thing differently to get a better, healthier lifestyle. Mine was to do at least 10,000 steps a day. Got a pedometer, which I wear all the time. It's easy to do when I'm at work. I did the one thing to try and just be a little bit healthier. And I do feel better. I've lost a bit of weight. I feel much better in myself, and I'm really pleased that I did it.
Dementia and mental health inequalities are another concern for the council. Introducing books on prescription is one initiative aimed at addressing that.
The Books on Prescription scheme is one part of a campaign to try and improve people's mental health and wellbeing. And it enables people to access information and support directly through their local libraries and also through GP practices, and gives people the kind of resource and information that they need to be able to sort of help themselves initially, and then be signposted on to other services if required.
The scheme is part of a wider range of mental health support initiatives, which includes wellbeing hubs.
The Wellbeing Hub is an open access drop-in for the local community. It enables people with mental health issues to find a pathway back onto that road to recovery. The reason why it works is that individuals who access here chat and talk and socialise and are no longer isolated, and I think that's the biggest selling point of our service.
The hub to me is a safe place. It's a place where I know I can come and be safe, I get my confidence up. There's people here that will help me no matter what. And it might not just be the staff, it might just be somebody who actually comes and visits and has a coffee and a talk.
Warwickshire County Council say feedback from all these schemes has been positive. This work contributes to the delivery locally of the 5-year forward plan, embedding prevention in everything they do and tackling the health inequalities that exist in the county.
We look in Warwickshire at embedding health priorities into everything we do, and that includes working with all our partners, that's the boroughs and districts, because housing is a determinant of health, working with the doctors, the CCGs and public health across its widest remit.